742, it is Alabama's Morning News. I'm JT. Joining us now, Dr. Bryan Ardis, who is the CEO of ArdisLabs.com, to talk about Remdesivir and a personal experience he went through as well. Doctor, welcome in. Thank you for being with me.
Thank you, JT. I'm glad to be on your show.
Yeah, first of all, I want to ask you what Ardis Labs, what do you do in your labs?
So Ardis Labs is a company where I develop and formulate nutritional products to actually specifically target the cause of symptoms that people experience. The first is a product we created to eliminate the causes of acne from the inside out. So acne is caused by hormonal imbalances internally that are actually caused by mineral and vitamin deficiencies. So we created, the first time ever, an internal solution to acne with a dietary supplement that includes minerals and vitamins we lack that causes hormonal excess that causes acne. And it's a revolutionary product, and it's all natural, and we're very proud of what we've created.
All right, ArdisLabs.com. Check it out. But, Doctor, I want to talk to you about what happened with your situation in your family. Apparently, you lost your father-in-law, and you say it's because of ill-advised hospital protocols. Was he a patient with COVID?
This is actually just prior to COVID, so he might have had it, but this was in February of this year, 2020.
Okay.
He walked into a hospital the second week of February with fever and a headache. They actually diagnosed him with the flu and then started treating him with 3 antibiotics and sodium chloride, which is IV fluids. And by day 2, he was diagnosed with pneumonia. Day 3, he was diagnosed with renal failure. By day 4, it was double pneumonia. By day 5, he had fluid on the brain and went unconscious. I wasn't allowed to go up to the hospital until day 5 because my mother-in-law actually fell and was in a rehab center from breaking her neck. And when the rehab center found out that he had been diagnosed with the flu, they didn't let anyone else go to the hospital to visit with him in case we brought the flu back to the rehab center where the other elderly patients were. So we took those precautions. But by day 5, when we were being told his failing health was occurring the way it was so fast, we went up there on day 5, and I did, and then went through all of the day-by-day protocols that had been put in place to help my father-in-law, only to find out that he actually was never confirmed to have the flu on day 1, nor had he been tested positive for bacterial or viral pneumonia. And the protocols they did use there were a combination of several drugs that shut down his kidneys from day 1, causing acute kidney injury and failure, and his lungs filled with water as a result. Your kidneys actually eliminate water, and as you shut down the kidneys are responsible for eliminating the water. The water starts getting built up into your belly, your abdomen, and then it goes and saturates your lungs.
So what happened with Remdesivir? Was that part of this? Or how does this, apply to the Remdesivir position you have?
Yeah, so when we found out, when I watched the scenario where within 12 days, the protocols in the hospitals that I was demanding them to change, they did not. They stood firm in their protocols. By day 12, he was dead. I watched that. That was very disturbing, upsetting. And about 3 weeks ago, I decided I wanted to look into what were the protocols that we're using in hospitals now for COVID. And I don't know if you're aware of this, but Remdesivir, when I found out that the National Institutes of Health, this is the protocol being recommended to hospitals from day 1 with COVID-19 patients. Remdesivir is actually a non-FDA approved drug for anything in the United States. First, I found that disturbing. I don't know if any of your listeners know that or if you even knew that, but it's not FDA approved for any kind of medical condition. It is an investigational drug. This actual drug is being used on patients with COVID. Remdesivir has been shown in multiple studies, one with Ebola patients 4 years ago in Africa, and then a COVID, a manufacturer's compassionate user program. So Gilead, the company that makes Remdesivir, did a cohort study in China at the initial onset of COVID. Those actual 2 studies actually show that Remdesivir causes multiple organ dysfunction syndrome, which is the number 1 cause of death in ICUs. Then it also causes acute kidney injury, which is acute kidney failure, which is also fatal. And you're hearing a lot about that with corona patients. And having witnessed a drug protocol in hospitals literally kill my father-in-law and end his life in February. And now to learn they're using a similar drug that causes the same reactions in the body, I'm very surprised that they would choose a drug that has these known side effects. In fact, that cohort study in China with COVID patients, 23% of all of the patients who went on Remdesivir had multiple organ dysfunction and acute kidney failure. 8%.
Well, doctor, why do you think that these other doctors are now saying that's the drug that's showing promise?
Yeah, I have no idea why they're actually saying that. All I have is statistics, facts. I've got the figures from each of the studies. I have all the references to support what it's doing. And all I see are continued reports that this is the number one cause of death in ICUs by John C. Marshall, which is an MD. I've got the Mayo Clinic's references on acute kidney injury, that this does lead to symptoms that look like pneumonia. It's called pulmonary edema. Your lungs fill with fluid with pneumonia. Your lungs fill with fluid with pulmonary edema, which is a result of acute kidney failure. And I have put together an entire report because it is true. You've got these options now by the NIH and CDC, which includes Remdesivir as the primary mode of treatment. But there's actually a Dr. Richard Bartlett in Odessa, Texas. He's a medical doctor who has produced and found a cure for COVID within like a week, which includes 2 FDA-approved drugs and zinc supplementation. And this actual protocol has been given to...
Well, doctor, hold on 1 second. Hold on. We've got to take a break here. We're up against the clock. Can you hang with me just for a minute?
Absolutely.
All right, stay with us. More with Dr. Bryan Ardis and why he thinks Remdesivir is not a good protocol to be taking, and what these 2 other drugs he's talking about are that he believes show greater promise. We'll come back with Dr. Bryan Ardis. .754, it is Alabama's Morning News, continuing our conversation with Dr. Bryan Ardis, who is the CEO of ArdisLabs.com. Dr. Ardis, so glad you're with us here. Once again, he believes that Remdesivir, not good and should not be used. It's not an FDA-approved drug to battle coronavirus. Obviously, we've been talking about this for quite some time. There are a lot of doctors around the country, including Dr. Fauci, who believe that Remdesivir is a good protocol, but... apparently, we're learning as we go through this. You remember, Dr. Ardis, when they talked about hydroxychloroquine, that should be good with the zinc, and then, oh, no, that's not any good. Take that off. So where are you on hydroxychloroquine?
Yeah, there's a couple things. When you look at NIH's website and their protocols when they're telling hospitals that their number one drug they should use is a non-FDA-approved Remdesivir, they also quote that they do not recommend hydroxychloroquine or chloroquine. And what I find interesting is on NIH's website, they actually quote several studies for hydroxychloroquine and chloroquine and why it is they don't support the use of those 2 drugs. The unfortunate part I find with those studies that they actually quote, those 2 drugs are actually combined in the individual studies with an antibiotic. JT, I have a problem with this. Do you know what antibiotics treat?
That big bacteria.
That is bacterial infections. What is coronavirus?
That'd be a virus.
That would be a virus, right? So I have a couple problems here. I have a problem with Remdesivir. It is dangerous. It actually causes multiple organ dysfunction failure.
Right.
It causes acute kidney failure. And then I got a problem with all the antibiotics they're pumping into people. I mean, there's multiple articles where the CDC says it can do more harm than good to use antibiotics when you have a viral infection. So the fact that they have quotes of research studies where they're using antibiotics to treat viruses and those aren't showing good benefits, there's a reason. Antibiotics don't treat viruses. So those are already flawed research studies they're quoting.
Well, let's talk about, you were hinting and talking about a couple of drugs that you believe are good in the coronavirus protocol. What are they, and where are we in the progress as far as being able to get them out there more?
Yeah, so budesonide, I'll just say Dr. Richard Bartlett, I actually have his entire protocol that he submitted to the White House. Actually, he got it to Ted Cruz, who got it to Donald Trump 2 weeks ago. Since March, he's seen 5 positive COVID patients every day in practice, 100% cure rate. And this is incredible. He uses 2 medications, budesonide, which is an inhaled steroid. He puts it in a nebulizer, and they do two times a day, a 5-minute breathing treatment, which helps reduce the inflammation in the lungs so these corona patients and COVID patients can breathe. Then he uses clarithromycin, which is an actual antibiotic. I actually don't personally like the antibiotic part for these, but he's using it to try to prevent the possible bacterial pneumonia they believe can come as a result of COVID. And then he uses zinc as a supplement at 80 milligrams, and he discusses
there it is again.
Zinc is antiviral. Zinc shows up. It's amazing. And then the actual 3 combinations of products to treat, or medications and supplements to treat these COVID patients, the one that's known to be antiviral is the zinc. And I have an entire protocol here, 100% success rate. He's a medical doctor.
That's Dr. Richard Bartlett, right? Dr. Richard Bartlett?
Dr. Richard Bartlett out of Odessa.
All right, Doctor, we are up against the clock here. We've got to run. I'm going to have you back next week, and we'll talk a little bit more about this. But very interesting information this morning. Once again, Dr. Bryan Ardis is our guest, anti-Remdesivir and pro these other drugs. We'll have this in a podcast after the show on our website, WERCFM.com, if you'd like to go back and listen to it. Once again, Dr. Richard Bartlett is who he's referring to in the new drugs and their protocol. Thank you, Doctor. I appreciate you. Coming up 3 minutes, Alabama's Morning News, traffic and weather together. Stay with us.